Again, going down the list of services you provide, medical and surgical treatment of endometriosis. Did I pronounce it right?
Yes, you are.
Good for me. Okay, let's talk about that. What is that to begin with?
Endometriosis is where cells from the lining of the uterus have implanted abnormally into other areas, usually inside the pelvis. And they can be behind the uterus in a place called the cul-de-sac. They can be on the ovaries themselves. They can even attach themselves to the colon or the appendix.
So what do you do?
Well, it depends on what symptoms the patient is having.
What would be the kind of symptom the patient would experience?
Oftentimes it's pain. Most of these patients present with pain. We usually start out by doing an ultrasound, which can depict very large lesions of endometriosis called endometriomas. For some patients, we do a laparoscopic surgical procedure where we would take them to the operating room and with a telescope take a look inside their abdomen at these lesions.
Right.
We can laser or cauterize those lesions. We can also offer different medical treatments for those lesions as well.
And once you treat that and it's cured, is that the kind of thing that comes back again frequently, or is one treatment sufficient?
Not uncommonly, it can come back again.
It does.
And requires further treatment.
Okay, very good. Talk to me about the medical or surgical treatment of painful periods. You know, when women do have that problem, it really can necessitate surgery?
It can. For some women, they have to lose time from work every month because of the pain that they experience with their periods. Oftentimes, just by giving them some kind of medical or hormonal therapy that might be as simple as birth control pills, that can alleviate a lot of the suffering that they have. We have more long-term hormonal treatments which can eliminate periods for many of these women, which can be helpful. There are also some surgical options as well, and it can lead up to even a hysterectomy if that's what the patient is interested in. But there are less invasive surgical procedures that can be done. An endometrial ablation can sometimes be done, and we can even do that in the office now, or we burn or cauterize the lining of the uterus, which for some patients eliminates their periods entirely.
And female incontinence, what do you do for that?
We have a lot of patients who will come in, particularly after they've delivered several babies, who lose urine when either they cough or sneeze. Mm-hmm. And there is a simple surgical procedure that we can do involving just a small incision in the vagina as an outpatient surgery that can help suspend the urethra, which prevents the loss of urine when they cough or sneeze.
Is that pretty common in women who've had children?
It is very common. About 30% of women who've delivered their babies vaginally can develop that problem.
It seems you hear a good bit about that. They advertise on television, procedures. It's pretty interesting. And what about the screening that you do for cervical and breast cancer?
Well, about 11,000 women will be diagnosed with cervical cancer this year, and almost 4,000 of those patients will die, actually, of cervical cancer. And that is a great tragedy, mostly because if women will come in for their cervical screening tests or pap smears and follow the recommendations, if there's an abnormality detected, cervical cancer could really be almost 100% preventable.
And how often do you recommend that a patient get a pap smear? Is that an annual test?
It should start annually.
It should.
After 3 normal annual tests, then that screening interval can be widened depending upon the patient and the comfort that she has with her doctor.
Okay. You also mentioned here in-office treatment of abnormal pap smear. What would be an abnormal pap smear?
An abnormal pap smear would be a pap smear that includes cells that might have a potential to turn into a cancer. And that's why pap smears are such a successful story as far as prevention of cancer is concerned, because normally cancer can be detected even before it becomes a cancer or it becomes an invasive cancer. And at that point, there are a lot of options that we have to treat that. We can burn or cauterize or actually remove it, usually through an in-office procedure.
All right. And then the other subject that's one you hear a lot about mentioned is women who are having problems during menopause. What can you do for them?
The main problems of menopause that women typically come into our office for would be the hot flushes and the vaginal dryness. And there are hormonal options for those patients, just an estrogen replacement, either given orally as a pill or as a patch, or even as a cream or a lotion that they can apply. They even make small tablets that can be inserted intravaginally that can help those symptoms as well.
So it really is a wide range of services that your clinic, your practice provides for women. It's pretty fascinating. How long has the practice been in existence?
Well, Dr. Thackeray and I started out in 2000, and then Dr. Epstein joined us a few years later.
All right. Well, it's very interesting hearing about all of these procedures. We'll be back more to explore this practice in more detail, and we'll do that in just a moment. We'll be right back.
We have been watching the operations of an organization which is doing its part to keep America strong, and we've been learning from its leaders about what they're doing to help move our country forward. This organization represents companies across our great nation that embody the spirit, dedication, know-how, and can-do attitude which has made America the great nation it is today. And now let's present the Keeping America Strong Award.
Now it's my honor to present this prestigious award to Dr. Spencer Colby of the Jordan River Women's Health Clinic in West Jordan, Utah, for the outstanding work that his clinic and his partners are doing to keep America strong and keep their patients healthy. Doctor, it's a pleasure to give this to you. Congratulations.
Oh, thank you very much on behalf of myself as well as Drs. Thackeray and Epstein. We're thrilled to receive this award. We're also grateful for all the help which we've received from our office staff as well as the many patients who have allowed us to help them and to be part of their lives.
Well, you're obviously successful. So what do you attribute your success to? Any particular philosophies or strategies?
We believe it's our customer service. We make ourselves available. We have extended hours. We are able to see urgent problems either that day or the next day in the office. More routine problems we see within just a few days or a week or two. We accept all major insurances as well as state insurance, Medicaid and Medicare, and we don't limit our patients based on their ability to pay. We offer deep discounts to women who are self-paying patients.
If you'd like more information on this medical practice, you can find it on the web. Their address is www.jordanriverwh.com.
I'm William Shatner. Thanks for watching.